A very warm welcome, everybody. Thank you so much for coming along today. It's great to see so many of you here. And it's a real privilege to be hosting today's session with our three wonderful speakers. So I'll introduce each of them individually as the papers go on, and then hopefully at the end we'll have enough time for Q&A and kind of a more in-depth discussion. So the first speaker I'd like to welcome today is Dr. Dee Bennett Gale from the University of Albany in New York. So I will hand over to you now, Dee. Thank you.
Hi, thank you, Emma. Thank you for inviting me to the Cambridge Disaster Research Network. I am honored to be here. My name is Dee Bennett Gale. I'm an associate professor at University of Albany in New York. And I have a brief talk to you called 8 Years Later, Sendai Framework and People with Disabilities. And so if you're unfamiliar with the Sendai Framework, it was adopted by the United Nations member states in 2015 and included 4 priorities to guide action around development and implementation of policies on disaster risks reduction. I'll go over the four priorities a little bit later, but it is also one of the first global frameworks which purposely considers the needs of people with disabilities. I was invited here by Emma because I wrote a paper in 2020 called 5 Years Later. So hence I changed the title a little bit for this discussion to talk about 8 years later. So I'll kind of go over what I found 5 years after the Sendai Framework, and then some of what research is showing since 2020. So the 4 priorities for action from the Sendai Framework for disaster risk reduction, which I shorten and call Sendai Framework, is first to understand disaster risk, and 2, to strengthen disaster risk, and 3, investing in disaster risk reduction, and 4, to enhance disaster preparedness. The paper that was inspired by this talk is based on these 4 priorities, and I looked at what was happening with people with disabilities across a number of different countries, and then put into these different 4 priorities kind of how it translated into these spaces. So the first thing to know is that we should definitely be considering this. So why disasters? By my rough count, disasters have impacted directly or indirectly billions of people since 2015. But of course, as a disaster researcher, I include the pandemic in that count. So clearly it's affected all of us. But even without the pandemic, as you see here, it's just the sheer number in costs and frequency of disasters from natural hazards since 2015. And if you're following the orange line, you should be looking at the left axis here, which kind of talks about the cost in billions. This is in US dollars, and they're all set to 2022 dollars. And then if you're looking at the bars or the columns in blue, you should look at the right-hand axis, which is basically showing you the number of disasters, the total number of disasters. And you can sort of see that there's a little bit of a give and take with how many disasters we have. But if you look at the first 4 compared to the second 4, there's clearly an increase in what we're seeing in terms of the disasters. And there are a number of sources that you can find for this. I took some of the data from the Emergency Event Database and the Center for Research and Epidemiology on Disasters, and also World Vision, which has some of these information there. So definitely we're considering disasters because they're increasing in cost. You know, there's some blips there here and there, but generally the cost is increasing. Also, the number of disasters are increasing. And then why look at people with disabilities? There's an estimated 1.3 billion people worldwide that experience significant disabilities. This represents about 16% of the world's population, or about 1 in 6 people have at least one disability. And then when you also look at disability and compare to some of the other things that we also think about in terms of vulnerability, such as employment or unemployment, children living in developing countries, or having multiple disabilities, you start to see that the picture gets a little bit more murkier in how many people are affected by having a disability or not having a disability, or working around people with disabilities, or living with people with disabilities. So it's definitely a larger portion of our population, and one that we often don't consider fully. And before I get into my talk, I like to at least couch this with the understanding of there's different ways of looking at disability. So one way of looking at disability is from a moral standpoint, where it can be either negative or positive, and disability is either connected to karma, like something, a mark of wrongdoing, either for that person or for a family member, or as honor and strength, meaning like having survived a particularly hard life challenge. There's also a medical perspective of disability, where it's seen as an impairment, and the goal is to return people to as close to normal as possible, and that normal is typically centered around people without a disability. The issue there is with the lack of ability, something that needs to be fixed in order to fully participate in life. And the onus is often on the individual and something they have done for both the moral and the medical, either something they have done or something that's different with them, or something that has been either morally passed down from their family or heritage. But I look at ability and disability as a social construct. And that's the third model, where it's seen as an aspect of a person's identity where environment is causing barriers for people, for all people to enjoy life. And it could be through infrastructure or social societal norms. And so if you see sort of the definitions here, it's correlated with the external social factors where people are failing to consider the needs of people with disabilities. It also focuses on the cultural and barriers and attitudes that lead to exclusionatory practices and can marginalize people with disability in terms of their access, accommodation, education, employment, and voting, just to say the least. Of course, we also see this in disaster risk reduction. So from that paper, what I did was look at a review of different national disaster plans from a number of different countries. So you can see some of them here. The ones that I clearly stated inside of the paper were Australia, New Zealand, Philippines, Thailand, United States, and Vanuatu. But also included in the paper was Bangladesh, Cambodia, Jamaica, Japan, Solomon Islands, and Zimbabwe. And one of the restrictions I had was that I focused on plans that were readily available online, and also plans that were in English that I could actually decipher. So there's a lot more here that can be said about other plans, but if it didn't meet that criteria, I did not include it in this particular paper. So some of the findings were in understanding disaster risk, which was the first priority for the Sendai Framework, is that there's a lack of consideration for the heterogeneous nature of people with disabilities, the fact that they're multifaceted with a variety of needs and they don't all fit one model, right? And one of the three populations that clearly came out as being completely ignored were those with mental health issues, anxiety, stress, depression, deaf populations, and children with disabilities are underrepresented in a lot of our frameworks out there. And I believe that can also be extended to different cognitive and behavioral disabilities as well, where we're not thinking about those populations. We need to, in order to understand disaster risk, we need to understand and work on building capacity for individuals with disabilities, including the human capital, which includes like workforce or education, the economic or financial capital, which thinks about their savings, credits, wages, and debts, which should be now clearly important, given that often we see a correlation between disability and employment or unemployment and wages. And third is social capital. And when we talk about vulnerable populations, or socially vulnerable populations, as I like to call them, and these are often marginalized populations within different societies, we see that the lack of different networks and support, different shared values and representation often make a significant impact on how they fair during disasters. And so that leads to the final finding, which was around, this move, this shift, moving towards social capital and beyond this perceived social support to a realized membership and partnership. And this idea is that we have to include people with disabilities and other marginalized populations in the discussions with policymakers and practitioners and individuals from the disability community, all working together to kind of realize what their disaster risk is, where they may have some needs, where they can offer something as well. And so it's bi-directional, it's not just one way. The second priority was in strengthening disaster risk. And this is where I, of course, was looking for inclusion within plans, but I think that inclusion has to happen within developing the plans and not as an add-on to it, right? So it's almost obvious that in some of these plans that it was kind of an add-on. Let's figure out where we can put vulnerable populations and include them, but that's not real inclusion, right? So across the different geographical regions, researchers have noticed that the participation among people with disabilities has not occurred. And it's not just people with disabilities, it's kind of all of these populations that we consider marginalized. And so when we think about the broader social vulnerability within the United States alone, it's more than 50% of our population that is considered socially vulnerable. And when we think about it in that terms, it's almost egregious that we do not include all the different populations in the plans. Also connected to, I guess, more of my lens by which I'm looking at disability as a social construct is the lack of inclusion may be the result of cultural biases and discrimination concerning people with disabilities. And the inclusion in disaster planning may also be hindered by discrimination or by the lack of the definition of disaster or both. So it could be the definitions. Some of the things I came across in the paper was that the definitions of disability, how the lens in which people look at disability is different. So if you're looking at it from a medical model or a moral model, that will dictate how you think it's included or not in your plans. And then also the definition of disaster was different across a lot of plans, and some researchers were trying to grapple with that. And so for me, I use a definition from a researcher, Fritz, from 1961, in which he thought of disasters as a social construct which causes social destruction, and the needs exceed the capabilities of the area. And that kind of separates it from smaller emergencies or things that may be, a disastrous situation for maybe a household, which doesn't necessarily meet the needs of thinking about a large-scale disaster. But that definitional change actually started to cause problems in where people saw people with disabilities being included or not because of how people thought a disaster was defined. Third was investing in disaster risk. The investment in data collection and policy development to decrease vulnerability was actually lacking for a lot. And it's kind of this idea of put your money where your mouth is, right? So if you're saying that you care about inclusion, you care about people with disabilities, investing in good data collection around the things that are happening with people with disabilities, creating policy around the decrease of vulnerability is actually a good thing as well. But collaboration and coordination must actually include the different variable types of disabilities. A lot of times it was just those with mobility disabilities that were thought of, but not necessarily all the different other types of disabilities. And the development of reliable quantitative data on the experiences of people with disabilities is also lacking. What we have is a lot of high-level policy thought processes around what might be the impacts for people with disabilities, but not a lot in terms of asking people with disabilities what their experiences were and having that so that we can actually work towards meeting those needs. And finally, enhancing disaster preparedness. The findings there was basically a need to empower people with disabilities, providing a voice to the voiceless, and addressing compounding vulnerabilities, because we don't really think about everything in silos or in a vacuum, where we're focused on people with disabilities, or focused on racial and ethnic minorities, or focused on LGBTQ or women's issues or children's issues, but not thinking about the fact that someone could cross all of these different barriers, right? So they can be a woman with a disability who's a racial and ethnic minority, who's also a member of the LGBTQ community. And all of that needs to be considered, because then with the compounding vulnerabilities, you also have compounding marginalization. And so there are different things that they are considering and dealing with. And here in the United States, I think after Harvey, there was a congressional hearing, or Hurricane Harvey, sorry. There was a congressional hearing in Texas that in which racial and ethnic minority people with disabilities were talking about their unique issues during that disasters. And yes, it overlapped with people with disabilities. It overlapped with different racial and ethnic minorities, but it was very unique issues that they were coming up with and feeling completely ignored and unheard. So what does disaster risk reduction look like for people with disabilities, and what should we be thinking about? And I came up with 3 things, which was understanding definitions and inclusion. And so while we can define disasters to some extent, depending on if you choose to put that up front, and defining disability, especially the lens by which we are looking at disability, I think we also need to start defining inclusion and what that looks like, because just like we say diversity all the time, we say inclusion now all the time, and that looks like something different for everyone. So what does that mean? And I think it's not just engaging people one directionally, where you're saying, yes, I went out to disability organizations and I told them what needs to happen, but that you're actually including them, and it's a bi-directional thing. And you know, we have tons of things through history in which tons of examples through history of disasters in which people with disabilities from different types of different disabilities have actually been the ones to have more knowledge than those without disabilities, because of the way in which they have experienced disaster and have helped people during disaster without disabilities. So maybe there's a way in which we can learn from people with disabilities and not just think that we're having to tell them. So it's not just understanding their needs, but understanding where they are, may have some empowerment or something to offer as well. Intersectionality is a newer term that we keep hearing over and over again, which was developed by Kimberly Crenshaw. But basically the idea is that several characteristics influence vulnerability, and what I called compounding vulnerability on one side, I'm calling it the fact that we are more than just one thing, right? So we have to consider the fact that individuals may be more members of more than one group. We are not just one stagnant kind of individuals. We're very dynamic, and we move in and out and across different groups, not to mention the fact that disabilities is not always a permanent thing, right? We move in and out of disabilities as well. And then there's differential disparities. So even within this bigger group of people with disabilities, or the even larger group of people with vulnerabilities, there are all these different groups within there that have specific needs that we need to consider. So then I have recommendations for research, practice, and policy. For research, it's to build capacity among people with disabilities during disasters and figuring out how to include them in our research models, addressing cultural attitudes towards people with disabilities when we're thinking about our research within the framework of disaster, and how people's attitudes may project how they think risk reduction for people with disabilities will work. And making investments in people with disabilities. We have not done a lot of research on the investments made or not made around this. And so we need to kind of consider that, and thinking about conducting global comparisons on the implementation of Sendai Framework as a policy analysis. Policy recommendations is to include purposeful definitions of disasters. And so within the Sendai Framework, they have a definition of a hazard, but not necessarily a definition of a disaster. having clear and purposeful definitions of disability, making considerations for intersectionality of vulnerability dimensions, and recognizing the differential impacts for the various types of disabilities. So you can't just say, hey, we're going to do this better for people with disabilities, but not thinking about blind, low vision, people with mobility disabilities, people with mental health, or children, the like. And practice recommendations, understanding and incorporating the social model of disability. Without doing so, then you're constantly thinking that there's something that needs to change with the individual in order for them to be properly included. Considering the necessity and facilitation of independence and self-sufficiency. Within the United States alone, we have a number of individuals with disabilities who readily join our workforce and are able to live, work, eat, everything on their own. And so understanding that they still have specific needs is important. And acknowledging cultural attitudes and biases, which may increase the difficulty for people with disabilities. So that's what I came up with since 2015. So what has changed? Since 2020, I found that there is different impacts, and that there, at least one author starts to talk about that with people with disabilities, there are severe human rights violations. And if we start to think about it in that way, it seems like they're being neglected it should be considered a violation of human rights in the way they're taken care of. The idea of inclusion, it's still important, but the pathways to inclusion are unclear and fragmented. There's also this level of difference between the higher level laws and lower level laws, which again is a limitation of the first paper that I did, which was I looked at these national level policies. And I think I did mention the fact that even within the United States, the national level policy is only going to tell you so much. Each state's policy will tell you a little bit more, but how it's implemented in terms of practice is going to tell you exactly what people are understanding about inclusion. And so I'm just referring to people with disabilities as a vulnerable group or part of vulnerable groups makes their needs kind of watered down and not seen. And there's a difference between talking about things from a disaster risk reduction organization standpoint and from an organizational standpoint for people with disabilities, and that those two need to come together. So it would actually be better to think of an organization for people with disabilities that also considers disaster risk reduction, which would start to bring the two things together. And then the commitments to share data is only occurring, well, at least more than 50% occurring in non-government organizations, the private sector, and other networks, being the largest stakeholders with some sort of drive to share their data on people with disabilities, inclusion, and disaster risk reduction, meaning that our governments aren't actually sharing that data, which could give us the impression that they might not be collecting that data or they haven't thought about it. And then recommendations from other papers is on this idea of a person-centered capability framework for disaster risk reduction, and having more community-based approaches to engaging people with disabilities, thinking about at least the CBU disaster inclusive disaster risk reduction network, which is hailed as one of the better ways of including people with disabilities. And it's a multi-stakeholder advocacy coalition participated actively by various organizations of persons with disabilities, civil organizations, and government agencies. And then again, this more systematic data collection for people with disabilities, need, vulnerabilities, and capacities. So what I've gathered from all this is very little has changed since 2015, and that we will likely still see that we're trying to work towards better inclusion of people with disability, even as we reach that 2030 mark. So I have some of the references here from the newer articles that I referenced. Thank you so much again for including me, and here's my contact information.
Right. Thank you so much for that, Dee Dee. That was absolutely fantastic, and there's lots to think about there. And yeah, it's quite timely as well, because the Sendai Framework midterm review has just been released very, very recently, which is dealing with kind of, you know, how far have we come and what is still left to do. So I will share the link to that report at the end of the session. So thank you for raising some of those issues. So now I will hand over to Kevin Blanchard, who is a DRR specialist. So thank you, Kevin.
Thank you so much for having me. I'm just going to share my screen very quickly. Okay, so everyone should be able to see my screen now. Thank you, everyone, for joining us today, and thank you to the team at Cambridge for inviting me to speak, and thank you to the other panelists as well. For Dee Dee, I'm waiting to hear the other one, but Dee Dee's presentation was absolutely incredible and really touches on a lot of the points that hopefully I'm going to raise today, and I'm sure will be discussed in the question and answer sessions. So I wanted to be a bit kind of broader with the work that I am going to speak about, and instead of focusing on one particular marginalised or hyper-marginalised group, I wanted to look at the kind of the general themes around how we as DRR practitioners, policymakers, researchers, etc., are working within the Sendai framework to hopefully build a more inclusive disaster risk reduction process and practice. And before we begin, I just wanted to kind of run through a couple of the terms that I'm going to be using today, just for clarity. So hyper-marginalised is a term that I have used in my work to focus on any group that has kind of additional vulnerabilities beyond those that we consider marginalised as mentioned within the Sendai framework or in the Sustainable Development Goals, etc. And they can be kind of cultural, social, economic aspects to their kind of day-to-day lives that mean there's an additional level of vulnerability and marginalisation attached to that person or to that community. So could include LGBTQIA+, lesbian, gay, bisexual, transgender, queer, intersex, asexual, and any other non-heterosexual and non-cisgendered people. Can also be related to Indigenous people, First Nation communities, sex workers, those experiencing homelessness, undocumented migrants, etc. So any kind of group that has this additional level of cultural, social, economic vulnerability or marginalization because of the situation that they find themselves in at that particular point. LGBTQIA+, I've just quickly explained what that is. And then Emma mentioned the midterm review, which is a process that's ongoing currently by the United Nations Office for Disaster Risk Reduction, where effectively we are halfway through the Sendai Framework period, and we are doing, or the UNDRR team are kind of reviewing on how that is going so far. And they've been calling for inputs from stakeholders, from member states, etc., to really kind of understand where we are under the Sendai Framework and how well or badly we're doing. So my paper that I'm kind of referencing a lot today will be a paper that myself and a colleague, Holly Seglah, produced last year around hypermarginalization and disaster data. And really I'm trying to understand and unpick how the importance of data and the importance of data within disaster risk reduction doesn't necessarily filter down to groups that are marginalized or hyper-marginalized, and considering some of the ethical questions that are raised when wanting to collect data around groups and parts of our society that have these extra marginalizations or have these extra vulnerabilities associated with their community or their individual state. So I think I want to start with a kind of a good news message. I think these presentations can tend to be quite kind of doom and gloom. I would like to say that I think Sendai is better than we've had before. I don't think, hopefully, I don't think there's anyone on this call who will think that, you know, we've had better frameworks in the past, specifically related to disaster risk reduction. Hopefully everyone can agree with this. If not, then we can have a conversation offline. But I would argue that in terms of the Hyogo framework, which is the framework that preceded Sendai specifically before that, and then we had Yokohama's strategy before that, I would argue that Sendai framework has by far more inclusion built into the words and the actions of the framework than we'd had before within disaster risk reduction on kind of a global level. So Sendai is doing well for that, and we're very happy about that, particularly myself, who's focused on inclusion in disaster risk reduction. And some of those good things, specific targets related to inclusion, specific guidance around collection and analysis of disaggregated data, which allows us to better understand how communities are being impacted by disasters, as opposed to everyone being a kind of a homogenous group that's just impacted in exactly the same way. And a better overall consideration of how disasters aren't equal in their impacts, how society and how communities within that society and individuals within those communities are impacted differently by disasters. I think we can all agree that Sendai does that better than previous frameworks. And this is all part of that kind of the broader theme around the 2015 agreement, the Sendai Framework, Sustainable Development Goals, climate change agreements in Paris, where they have this kind of this general theme around leave no one behind, this kind of idea that we shouldn't kind of forget those marginalized, those vulnerable at-risk groups that were, to a large extent forgotten before 2015 kind of really solidified them within that kind of global policy framework. So there are a lot of positives, and we should be happy with this. But as with any kind of human being, we always want more. And I think that's only, I think that's acceptable when we are looking at how people are impacted by disasters. We should always be striving to understand how we can do better and how we're able to reach those groups that have been hard to reach in the past. So it is nowhere near perfect, and we have a lot of work to do to get to the point where we are providing a disaster risk reduction policy basis, where we're providing practical guidance, where we're providing real world actions that is truly inclusive. And I don't think we're anywhere near to that point yet. From this particular presentation and from my research, one of the biggest concerns I have is around this idea of how the Sendai Framework frames marginalization or frames vulnerable groups. And as we will see through the Sendai Framework, for those of you who have looked at it, there are a number of groups that are specifically and explicitly mentioned throughout the document. So those with disabilities, as Didi was just mentioning, women and girls, those with economic hardships, etc. There are a number of groups within the framework that are explicitly mentioned, which is great. And we absolutely should be making more of that, and we should be building on that and ensuring that that work doesn't stop. But my concern is what happens to those groups who sit outside of those groups that we've identified. The framework, as I'm sure we all know, touts itself as this kind of all of society approach to disaster risk reduction. It's a nice fluffy phrase that really kind of gives this kind of approach of everyone is included within the framework. Well, that's not always the case. And what we as policymakers and practitioners often require is a level of leadership and a level of guidance from an international organization such as a UN body to enable that work to happen when we are looking at groups who traditionally are forgotten or excluded. So, the groups they've listed is fantastic, and we've seen a huge amount of work being done on that. But the groups that they haven't listed or they haven't explicitly mentioned within this work, we are still struggling in terms of policy guidance, in terms of actual real action on the ground. And I think that, for me, is a big problem with the Sendai Framework. And obviously, I'm not saying that's simple. That's not an easy ask. Working within the United Nations systems as I do now, I appreciate there are huge complexities to agreeing something like Sendai without, including all the other groups that I would like to see included. There are social constructs, there are cultural kind of issues and economic issues that make this ask really, really difficult. But I think, as my gran always used to say, just because something's difficult, it doesn't mean we shouldn't try to do it. And I think that as disaster risk reduction professionals and practitioners, that should be our ethos. Just because something's difficult doesn't mean we should kind of just ignore that and hope it goes away. And I think what we end up seeing is this policy desert. We end up with this kind of real world consequence of this lack of inclusion of these marginalized and hyper-marginalized groups within the Sendai Framework that then filters down to mean that policymakers in national governments, in member states, in NGOs, etc., are left with really no guidance on how to build this type of strategy or how to build policy around these communities. And yes, it is absolutely, vital that we reach out to communities. And as Didi was saying, there's this kind of two-way back and forth, absolutely. And I can't stress how important that is. But what happens when you have a member state that may, for example, if we are looking at LGBTQI plus people, if they don't at a state level recognize the considerations and the needs of that particular community in day-to-day life, how will that be then kind of filtered down within kind of an emergency or disaster situation where kind of day-to-day life isn't applicable any longer? And one of the things that I've been doing in research with my organization is speaking to NGOs, to member state governments, to organizations all around the world, trying to understand how it is that we can bridge this gap, how we can fill in the policy gaps that we've experiencing at the moment with hyper-marginalized groups. And I always get the same message. It's we need that kind of high level guidance to enable us to then go away and do work that's relevant on a national, on a regional, on a local level. And at the moment that doesn't exist. So I would argue that the United Nations Office for Disaster Risk Reduction and other UN organizations within the UN family have failed to a degree, these hyper-marginalized groups, in that they haven't given enough guidance on how to build a policy system that enables that to happen. And we need that work, and we need that research to happen to enable this kind of more inclusive, more fully inclusive disaster risk reduction process that I think we all strive for, and hopefully we can all agree that that's something that we desperately need. So we're currently in the middle of the midterm review, and I have just recently finished a piece of work for the United Nations Office for Disaster Risk Reduction that's looking at queer, gender and sexual minority populations within disasters, and has specifically had some of that work fed into the midterm review findings. I think there is a gender and sexual minorities phrase now within the final report, which is something that I don't think had happened before at a kind of a UN level around disasters, which is awesome. But I think, at this point, at this halfway point, what we should be doing as practitioners, as researchers, as academics, etc., is really ramping up this idea that actually, yes, it's great that we're focused on these key marginalized groups that are included within the Sendai Framework and within the SDGs, etc. But what about everyone else? What's about those people who aren't specifically and explicitly mentioned within this work? We can't forget about those. And as Didi also mentioned within her work, this idea of intersectionality is key to all of this, because it will be that, there are a huge number of, for example, if you look at LGBTQI plus youth, there is a higher percentage of homelessness within that particular community than anywhere else. There's a higher percentage of mental health issues within that particular community. So all of these types of things need to be considered in the broadest policy sense. And for that to happen, we need this central guidance. We need the UN system to really start providing data, start providing information, guidance, resources, etc., around how we build a truly inclusive system. And very quickly, just to summarize, a truly inclusive DRR really should be the only DRR that we're after. Like anything less than that, and we have failed, because a disaster risk reduction process that forgets one group isn't really truly a risk reduction, but it may well be to one portion of society. But unless that's everyone's covered, it really does mean that we as practitioners and researchers and people working in this process have failed. The Sendai Framework, as I said before, this isn't all doom and gloom. We have definitely made progress from previous frameworks, as well as the SDGs and climate change agreements. All of those are definitely heading in the right direction. But I would argue for a 2030 plus framework that, I would imagine will start being developed in, maybe the next 5 years or so, we need to have a better understanding of what marginalized and hyper-marginalized groups are and what they look like and how we can help them and how they can use their capacities and their knowledge and their information to build a better system overall. And I think, once we get to that point, once we actually start to recognize that these groups have that capacity and have this particular need and vulnerability and capacity, then that gets us much, much closer to a truly inclusive disaster risk reduction process. So thank you so much. I'm going to stop there. Thank you.
Wonderful. Thank you so much, Kevin. That was absolutely brilliant. And it's great to see, you being able to bring in your own experiences and reflecting on, the research that's happening, but also the practical applications of these things. So that's fabulous. Thank you. So our next speaker.
Emma, you just got on mute there for some reason. I'm not sure why.
I muted myself, sorry. So our next speaker is Dr. Nahid Rezwana from the University of Dhaka. So please take it away.
Thank you. Good afternoon. Can you hear me? Okay. So I'm sorry, my network is not working well. So I'm going to keep video turned off. Can you see my screen? Okay. Yeah. Okay. So I'm Nahid Rezwana, working as Associate Professor in the Department of Geography and Environment, University of Dhaka. Thank you so much for inviting me. I'm delighted to have the opportunity to speak about the gendered impacts of disasters and its importance in inclusive DRR on such a pleasant occasion. It's a tremendous honor for me. Today, I will focus on gender-based violence, healthcare access, and layered disasters. It will be a case study on Bangladesh. Bangladesh actually is a disaster-prone country, and it has a long disaster list. It is also the 7th climate change vulnerable country. According to the record, 185 extreme weather events were recorded during the year 2000 to 2019. This country was in the 7th position in terms of fatalities in 2019. So my speech is based on the findings of 5 researches, which were located in different districts of Bangladesh. It is in Barguna and the southern coastal region of Bangladesh, in northern part of Bangladesh. And these studies were based on both qualitative and quantitative methods and methodologies. So it will cover 3 disasters, which were flood, cyclone, and riverbank erosion. All the studies reveal that women are more vulnerable to men in regards of health, both physical and mental problems, gender-based violence, and healthcare access, as Seglah also mentioned in her paper in 2014. Now, if we consider findings of the mentioned researches in Bangladesh, it has revealed that women are more vulnerable in every phase of disaster. Lack of warning information, social attitude, and responsibilities for children and home sometimes create constraints for women for taking shelter during the disasters. However, lack of information as well as lack of confidence is the main reasons in many cases. Different types of gender violence also can be found while taking shelter, such as unwanted touch, stalking, abuse, etc. After disaster, discriminations regarding relief types and distribution, healthcare access, full availability, insecurity in shelters have been reported by the victim survivors. During the recovery phase, actually male-oriented or focused recovery programs are noticed in most cases. Now, if we focus on gender-based violence, it has been found that disasters intensify gender-based violence. Among the gender-based violence, child and forced marriage, dowry violence, wife abandonment, rape, sexual abuse, and threats increase in numbers. Every disaster adds new victims to the total number. Again, if we look that gender-based violence actually intensifies disasters. A single mother or women, young girls become more vulnerable to disasters when poverty intensifies gender-based violence conditions. it is actually a vicious cycle. Now, I would like to present some quotes of victim survivors from the field. The first quotation was of a young woman who were married off just after the cyclone Cedar. And she says that poverty increased after the cyclone and my parents did not make check on the man. The man was old, married, and had a wife and 2 children already. He lied and cheated me. Actually, these quotes, there were many quotes, but I have chosen only 4. And we can see from the second quote that a single mother was staying at someone's house without a pillow, bed, and mosquito during Cyclone Cedar. And it was a horrible time for her, and she suffered a lot. Next 2 quotes actually focuses on the impact of gender-based violence, both on physical and mental health. And we can see from the third quote that as she's saying that he hit me on my eyes 3 times, blood got clotted in my eyes. I cannot see well with this eye. I cannot even thread a needle. And the fourth one, very important, which is mostly kept hidden, that these victim survivors have mental health impacts. And we can see from the fourth quote that she's saying that I don't feel well anytime, I cannot remember anything. After my husband left, there is no one close to me alive. And she was isolating herself from the society, and she was saying that I tell my creator, please take me as early as possible. So these are the impacts of gender-based violence on women. And if we look at what happens to healthcare access, along with disaster-induced injuries, the physical and psychological impacts of gender-based violence do not always receive proper treatment, leaving survivors with long-term pain and health problems. This diagram, actually, if we see the relationships between factors influencing healthcare access in disaster, and if we do the gender analysis, we can see that the cultural factors like cultural attitude, norms, and traditions become the strongest factors which create differences among the male and female disaster victims in accessing healthcare after disasters. We can see from the diagram that repairing damages and collection of relief aids are the main cause of men not getting treatment of their injuries, whereas women face several other cultural factors in this regard. The factors we can mention that dependency for chaperone, decisions and money, responsibilities for children, increased household works after disasters, and conservative attitude to male doctors, and a stigma of relief collection. So when the other, if we have found from the researchers that when the other factors remain constant for the all, maybe a little difference, but these cultural factors create the differences between men and women. So, I would say that from these slides, we can call disasters are compounded by long-term pre-existing layers already in the place. So these predate disaster, intensify disaster, and increase future vulnerability. Actually, no disaster-free normality. And we can say that gendered pattern help to produce disasters, and part of what is disasters is patriarchy. So to improve the condition, what we can do? Some recommendations I want to mention here, that first we need gender sensitive disaster management plan. Placing intersectional gender analysis at the center of relief and recovery efforts, integrate and prioritize gender and socio-cultural practices, norms and beliefs in policy and practice are recommended. And planning for medical response in relation to geographical location and socio-cultural demand. Like I would say that they need they mentioned the victim survivors or the affected people mentioned in the research that they should choose close place for providing treatment facilities, and then female doctors and staff should be present in the medical team, involving more women in local disaster management committees, and providing incentives, money or donations for poor injured men and women. Arranging awareness programs at national and local level for both men and women is very important, like women's empowerment, capacities and strength, and disaster knowledge, disaster management plans at the family level, and assuring financial support for women and gender-based violence victims actually, and healthcare access for gender-based violence and legal support for gender-based violence victims. So all of this, I would say that above all, what we need more context-based, intersectional and participatory action research on disaster and gender to know that
Is there a problem with the sound?
Yeah, sorry, Nahid, your sound is just
can you hear me now? Sorry.
Yes.
Okay,
Sorry.
okay. Sorry. So we need more, actually more research on gender-based violence, which is related to disaster, because these areas actually face more disaster, more gender-based violence, and it is happening. It is actually interrelated, and they are actually all the time they are influencing each other. So we need more research on this topic. I think I'm finished. Thank you.
Fantastic. Thank you so much, Nahid. That was absolutely fantastic. And thank you also for including excerpts from your research and for sharing the stories of the people you interviewed. So thank you very much for that.